to more Paul W. Smith on WJR. Once again substituting, here's Kevin Dietz.
The numbers keep going up. The number of new cases, the number of deaths, the number of hospitalizations. Warnings are everywhere about COVID-19 to keep your exposure down and try to not spread COVID at this time when the numbers are so high and the concerns are real at the hospitals. To find out what's going on, what we can do, and what's really happening, joining us now is Dr. Roy Elrod, Chief of Staff at DMC Detroit Receiving Hospital. Doctor, thanks for being on the Paul W. Smith Show.
Hey, good morning. Thanks for having me.
So this is a tricky time. I think we all know people who have been or are in the hospital. I currently know two people that are in the hospital right now with COVID, and I follow the reports and I see people talk about the numbers going up at hospitals, and it's hard for us to know what to do, especially if we feel like we need to go to the hospital, if we feel sick, but maybe we're not that sick, or maybe it's not even COVID related, but we feel like we need to go to the hospital. What's the situation at the hospitals now? What should we be thinking about as it pertains to the numbers going up?
That's such a great and important question related to that situation. First of all, let me just let everyone understand that the hospitals, particularly the DMC hospitals, we've been preparing for this second surge after the last 8 months, and we are completely prepared in every way to assure that those patients and people that visit our facilities can rest assured that they're going to be taken care of in a very safe and secure environment. And I think that's echoed by all the leadership at the DMC. All of our physicians are doing the things they need to do to ensure that our patients are cared for in a very both safe and effective way. And so the message is that no one should stay home with symptoms that could impact their care because they're afraid to go to the hospital, which I'm sure that has been in the past. But we're clearly ready in every way for patients that need any type of care, from surgery, elective surgery, diagnostic tests that are very important for their health, to make sure that they come in and get those necessary tests done. Because what we're seeing is that patients are delaying coming in, and then when they come in, they're much more sicker, it's more difficult, their health care is challenged, and that's not what we want to happen to our patients.
Yeah, so there's that old saying, if you want to get sick, go to the hospital. And it's kind of funny, but it's not funny, because if you're sick, you really do need to get to the hospital. And
absolutely.
I imagine you guys have learned an awful lot from this first wave of COVID-19 to help you prepare for the second wave.
Absolutely. It's been incredible learning points over the past 8 months in terms of what we have to do. And so we put the protocols in place that we make sure at the very entrance of patients coming to the hospital that they're screened, they're asked questions, and that goes even for the healthcare professionals. There's no one that comes into the facilities without screening to ensure that they don't have signs or symptoms of COVID. And then as soon as they come in, we have COVID safe zone areas to place patients if there's any signs or symptoms that they may be sick at all. And then most important, I think, what we've been able to do is ensure we have all the safety protocols, equipment, supplies of PPE, and those things that are needed to make sure that our caregivers, physicians, nurses, and all that will be involved with interacting with patients are safe. And then we clean every area. We do all the detailed things to ensure that there's a safe environment and we can provide very safe care for our patients.
It's also flu season. What kind of flu are we seeing this year? Is it the kind that people are being hospitalized for the regular flu?
Yes, and so the flu, as we know, every year always has its own impact. And we're beginning to make sure to emphasize right away you should be getting your flu vaccination, which is such an important point, given the fact that we have a COVID, which can also be a second infection with that. So flu season, it is here. I think it's going to be challenging for us to make sure we're able to get everybody vaccinated for that vaccine to ensure that there's less likelihood that they have co-infections, which could be extremely difficult to treat for patients. So, but right now, I think early on in the flu season, people are getting the vaccines, and it hasn't been as dramatic as we expect it can be.
You know, you hear about people getting, thinking they have signs of a heart attack or something, and saying, "Well, I'm not going to go to the hospital. I'm just going to rest." And people, if they think they're having a heart attack, they need to go to the hospital. But what happens when you actually get to the hospital? I mean, are they putting COVID patients in one area and people who need other things in another area? What's the reality of what's happening?
Absolutely, and that's so critically important for people to understand. That has to be done. We understand that we've already have COVID-safe areas within the hospital to place patients so that they're separated from those who may even be potentially positive for COVID. So yes, that's been important, and we've even heard EMS tell us that they get a call sometimes, a 911 call, and when they go out to see the patient, sometimes they waited, saying that they didn't want to have to come to the hospital because they were afraid to come. And by that time, you're right. If they are suffering from either stroke, heart disease, these patients can come in a lot more critical. And so we're getting a message out that please don't delay your care. We have safe facilities to come to treat you, and you can be confident that we prioritize your safety and your health. And we've been doing that now, and please don't delay your care because ultimately we value that and want to make sure you're in good health.
Yeah, and the holidays could be a busy time anyway. You guys are at full staff? You're not having problems there?
No, we're definitely staffed, and we're all prepared to go. We always encourage that our caretakers are safe, not just in the hospital, but even when they're outside of the hospital. I think that's an important message to know, that to make sure that we stay staffed, they can't be involved with risky episodes or where there can be potential exposure. So we tell them, listen, even when you go outside of the hospital, wear your mask, social distance, hand hygiene, and try not to be in places where there's a high risk to get infected. So that's an important point.
All right, Dr. Roy Elrod, Chief of Staff, DMC Detroit Receiving Hospital. Thanks for being on the Paul W. Smith Show today. Have a safe and happy Thanksgiving.
Same to you, and thanks so much for having us.
You bet. We'll be back with more of the show. Let's check traffic and weather with Rich Lazinski.
This report is sponsored by Everstream.